Hey everybody, Jill here with Illuminating Women, and this is our Friday Lunch and Learn, because in Illuminating Women, education is so important. It empowers us and helps us move forward to meeting our dreams and our goals. Today, I have invited back Christine Zomorodian, who is also on our advisory circle, an amazing woman. I mean, she does everything, and it includes windows and toilets and gardening. So she does it all. But today, we have noticed that when we are in particular situations, like right now, we're in a pandemic. And so all of a sudden, you're going to see all of this information, medical information come out, and your head could be spinning. And some of it, you're just like, what? Stand on my head and sing hallelujah and drink water? What? You know, from the scientific. Now, what do we know? How do we figure it out? Where do we go? What's legit? These are all really important questions, because it can make a difference in you living or harming yourself in the ones you love. So Christine, if you just share a few things about yourself real quick, so that we kind of know a little bit about your background and crud you have that you're bringing to us. When I say crud, and just share a little bit about that and teach us today. And thank you again for taking time. I know you're helping a lot of businesses and companies during COVID to stay safe. So I appreciate it. I know you're a very busy lady. So thank you, thank you, thank you. So go ahead, share away with us, my dear.
Well, hi, Jill, and thank you for the intro. So let's see, I work in medical regulatory compliance for product makers. That's my primary field. But way back when I sort of got myself into this situation of being in science, I trained as a medical laboratory scientist. And those are the people that run the labs. Actually, they're just, at this point, they're basically just in management. They no longer actually do the testing, because they have machines for that now. And that's a whole diatribe I could go on if I wanted to, but I won't for this purpose. But that kind of gave me a grounding in clinical science. And I did work for some medical research firms, or science research firms. And that gave me some grounding in the scientific method. And then I decided I didn't have enough credentials. And so in 2010, I went back to school and I got a master's in regulatory affairs at University of Washington, where I now lecture and teach. And I'm helping them reconstruct the program at the moment, which is actually what's occupying probably at least 50% of my time. We're reformulating the program I graduated from. So that's very exciting for those of us in the field. Anyway, with coronavirus, what's been happening is, for me, it's in two parts. One part is it's affecting everyone, and the kind of information that's coming out, good and bad, is affecting everyone. And the government's response, local, state, and federal, as well as international organizations, has an effect as well. And then for my clients, you know, they're dealing like every other business with what are we supposed to do here? Everything from how do you go remote to, you know, how do we handle people in a workplace if some of our work has to be manually done. I mean, for example, I have a client on Bainbridge Island, and part of the product finishing process is manual, and it requires people. And so they shut down for 2 months and didn't produce anything, and they were getting PPP loans. And now they've reopened with all these precautions, and it means it just has a lot of impact, right? It's consuming PPEs, it's cleaning procedures, it's screening employees every day for fever and illness. It's people staying home when they even think they have a cold, right? Because maybe it's COVID, right? And so I've been integrally involved in helping think through all those issues. And I have other former clients calling me and saying, what are we supposed to do? Help us out here. And it's a rapidly changing field. And Jill reached out and said, you know, please let's talk about this issue about misinformation regarding science and medicine. And I said, Jill, I don't have time to do this. She said, well, we really need you to do this. So this is probably the least prepared presentation I've given here, and I apologize. This is by the seat of my pants. So we're doing a seat of the pants thing today. But I do intend to, at the end of this, I have a short slide deck started. I'll probably add a couple more slides, turn it into a PDF, and you all can reference it later on. So I'll put that up on the Illuminating Women community or wherever else Jill sees fit, maybe the website, what have you. Okay, so let's just get started with this, because I want to talk about the challenges we're facing with all this misinformation out there, and how do you even sort out what's right and what's wrong. But before we get to the details of how you do that, we have to make sure we have a common place that we're starting the conversation from. So I'm going to share my screen now and show you a few slides here. So the basic idea here, just how to sort medical and science news from fiction, right? And fiction is the kind word I'm going to use here, because obviously I have opinions. All right, so first of all, it's hard. It's really hard. I mean, we have the information age here. We have the internet age. And the internet is a wonderful thing. It's democratized news. It's democratized information. And that comes at a cost. And that cost is what I'm saying, freedom of speech is not free. And that's a very theoretical thing to say, right? And in the past, we've always thought of this in terms of our troops out there defending our freedom overseas against a dictator such as World War II. That's the one everyone wants to talk about, right? That's freedom is not free. Well, at this point, I feel like freedom is not free is about the fact that none of us know what the truth is anymore, because freedom of speech means that nobody really has to be accountable for spreading misinformation. And of course, this is tied into politics, obviously, but it's tied into so much more than that. It's, how do you even know that you're purchasing an item that you see advertised on social media that you want? Is it even a reputable company? And how long does it take Facebook to take those ads down when it's not a reputable company, right? I mean, this is all integrated. They're not separate phenomena, right? So, this is the issue, that people can write and share anything they want. And so we're left to sort out the junk from the gems, right? So here's, in terms of science news and medicine news and the way the medical community operates, we have to sort of start with an understanding about where are they coming from. And where they're coming from puts them at a disadvantage for media, and especially for social media, right? So scientists are trained in the scientific method. We're going to talk about that in a moment. Physician doctors are scientists. They are trained in the scientific method, and they practice something called evidence-based medicine. And in general, I would say that scientists talk in negatives. They're not here to make you feel good about things or to promote something or to encourage. Even when they want to encourage something, they don't use encouraging language because they're not trained to do that. They're not trained as communicators. They don't study marketing, right? They study science. And so they talk about what they don't know. And then in between what they don't know, they'll give you little narrow pieces and bits to chew on about what we do know. And I can say that as the coronavirus issues rolled out in January and into February, everybody was very cautious. We now have this phenomenon. I think they did an NPR poll. It came out yesterday, I think, that something like 70% of the country basically blames China for this virus. And that, I almost ran the car off the road because I was like, wait, what? I mean, yes, it happened in China. Yes, there's wet markets. You've probably heard about the wet markets where they have wildlife for sale and things. And of course, those are factors, but those are not new factors. This has been going on for decades, right? This practice in China, and the Chinese government's sort of being selective about the facts they share, that's also not new. But in terms of how the West was reacting, the scientists were very cautious, and they didn't want to overstate things. It took the World Health Organization, I feel like it was the end of February, and Tina's on, she can correct me if I'm wrong, because she's got this public health stats down better than I do. But it was a really long time, maybe even the beginning of March, before the WHO was willing to declare coronavirus a pandemic. And I'm using air quotes here, because that's a big deal. When you move from an epidemic disease condition to a pandemic, it means that it's across different regions, right? And it affects multiple countries and multiple continents possibly. And how public health officials react to the illness and the virus is related to the status of it, right? So they were all very cautious, and it took a while. And this is all about what I'm saying here. You know, they talk about what they don't know, and we've been hearing about what they don't know about coronavirus since the beginning. And everyone should be thankful for that, because it means they're not overstating what they know. So we found ourselves in a situation, we'll get into this in a little bit later, but like this whole thing about masks, right? Well, the people who don't like masks, one of the things you'll hear is, well, they didn't even think we should wear masks in the beginning, and now they say we all have to wear masks. That's just, you know, the government trying to control us, right? Or the doctors trying to control us. So in the beginning, they didn't understand the relationship between mask wearing and prevention of spread of this particular virus, and they were again being cautious, right? And also at the same time, there wasn't enough PPE, and they wanted to ensure that the people on the front lines of healthcare had access to those supplies, right? So that's kind of where that came from. That's where that started, right? Okay, so I'm weaving in bits of what we want to talk about with what I want to make sure we have a foundation of. So let's talk for just a moment. What is the scientific method? It's the systemic observation, measurement, and experiment, and the formulation, testing, and modification of a hypothesis. So that sounds very generic, right? But what it means is that when you have a phenomena, okay, the phenomena could be gravity, the phenomena could be a virus, the phenomena could be understanding arthritis, or determining how you're going to go about doing a heart valve repair and cardiac surgery. All those things follow the same pathway, right? The same has to do with astrophysics. Anything in science follows this process. And what I didn't get to put on this screen, because I'm doing this at the last minute, is the fact that the scientific method involves peer review, right? And that's super, super important. Peer review is the process by which scientists get to look at each other's hypotheses and each other's experiments and studies, and literally try to pick it apart. I mean, when you're doing peer review, your job is not to pat someone else on the back. Your job is to pick it apart and say what's wrong, and see two things. One, can you replicate what that person did? Can a different organization with a different lab or a different hospital or whatever, can they replicate the results that the first scientific team got? And it, you know, it's really important to focus on that. You know, I'm sorry, I'm reading a message here, and my brain just can't. Okay, how we know? Yeah, and the second bit is, of course, you know, so is it reproducible is a big thing. And then you have to evaluate the methods they used. And that's when I say that everyone's job is not to pat people on the back, but it's to pick it apart and see, well, what method did you use? You know, what does your data look like? What do your statistics look like? How many times did you replicate that yourself? You know, that's part of picking apart someone's method. So the point is, when you see something published in a scientific journal or a medical journal, I'm going to make a general statement here. It's been through that process. It's been through that rigorous process of peer review. And once it is published, it's continuing to go through that process. Other scientists in that field are looking at that information. And sometimes you'll see things disappear that had once been published, and that's called a retraction. And sometimes something that's retracted just gets corrected and it gets reused, or sometimes it gets pulled entirely. So an example of a correction, I guess, would be somebody's data, the data grids they put in the study, one of them had a mistake, right? Or they forgot to include a line of data, and they'll pull it back and they'll add that back and they'll republish with a correction, right? An example of information, of research getting fully retracted is the guy in England who declared after some minimal work that autism is caused by vaccines. And that was refuted. And the scientific community looked at that and tried to replicate his methods and asked questions about his data, and all the answers were not good. And so those studies were retracted, and the guy never recanted. And then it turned out it was discovered that he falsified information. He actually falsified information. And yeah, Tina's saying she can give some examples based on her experience with all this. And Tina, hang on to that, because maybe as we get a little farther along, I'll let you give an example of that or two. But anyway, so that's what happens in the scientific method, right? Okay, so remember the bit I said about doctors or scientists, right? So here's how physicians are trained to practice medicine. And it doesn't mean that physicians are the only healers, right? It doesn't mean that physicians are the only people that can provide healthcare. We all have had experiences, hopefully, with wonderful practitioners who are not physicians, right? But their practice, this is how they're trained. And I, for one, am very thankful that these folks practice this way, because it means that in theory, you can go to any physician and expect the same background of training and expect the same approach to evaluating your health and your conditions, right? Doesn't mean they're always going to have all the answers you need in a case, and that's why everyone has to be responsible for their own health care, right? But if you have heart disease and you need heart surgery, your expectation is that every heart surgeon knows how to go about that surgery and that they have a common understanding of how they're going to do it. And they do, and they do, and they spend many, many years refining those skills, right? So here's what evidence-based medicine is. It's the integration of individual clinical expertise with best available research evidence from systematic research and the patient's values and expectations. So for me, what's interesting about this modern statement is I would say that in the past, 50 years ago, evidence-based medicine definition did not include the patient's values and expectation. That's a response to the evolution of society, right? But the first part of that has always been true, right? And that's where the part about physicians are trained as scientists comes in. So when they look at research, they expect it to be systematic research, and they have journals they look at, and they'll only look at peer-reviewed journals, and the medical societies of different flavors for different specialties will only look at peer-reviewed evidence for their practice, right? And so guess what? That means that it limits what they're willing to practice. It limits the treatments they're willing to offer to patients, right? Because that's their system. It's very structured, and it's very rigorous. And if you're a physician and you don't follow this method, you're probably going to get your license taken away. So that's a kind of a hard stop for them, right? So evidence-based practice is sort of an extension of evidence-based medicine. It's the integration of clinical expertise and expert opinion with the knowledge, judgment, and critical reasoning acquired through training and professional experience. So these are two terms you can take away, actually three. So there's the scientific method is one, right? Evidence-based medicine and evidence-based practice. And that kind of explains how these folks come about the way they're approaching things, right? And that includes Anthony Fauci down to your family doctor, right? And even your nurse practitioner. And nurse practitioners don't get quite the same level of training as physicians do, but they definitely are schooled in the same way of thinking, and they operate on the same basis. And that's the same thing for physician's assistants, I would say, as well. Okay, so here's the thing okay, what did I, okay, see, I that was a template for the first part. Here's what I want to talk about: alternative and fake news. Alternative facts are fake news. Okay, there's no alternative facts in science, period. I'm going to make a statement here, point. I'm going to put a point on that one. There are no alternative facts in fake news. Now, that doesn't mean that there isn't things we're learning, and that there's not information that's being acquired anecdotally, and that, complementary and natural medicine doesn't have things to teach us and things to be learned. But there's a process of arriving at what's considered fact, and that's what evidence-based medicine does, right? That's what the scientific method produces, and that's what evidence-based method does. So when you see something out there and it's being described as if it was fact, we have to ask, is it fact or is it not, right? And what's happening now is scientists are definitely speaking out about false information and alternative facts that they say are diluting and harming legitimate research. So it's not only just that it's making people confused, they're saying that it's actually harming research. It's actually harming research, and it's affecting their ability to conduct that research, get funded for that research, get it published. And, you know, so for example, the CDC's had a Facebook page for a long time, and I've been following it for a long time, okay? And I have to say that consistently, every time they post something on their Facebook page, they are mobbed by trolls, absolutely mobbed. You know, I would go on the post and think, oh, am I going to see some good questions that are elucidating, you know, response on some of the gaps in what the post was, right? Or am I going to learn something? I can tell you that I almost never learn anything from those posts on Facebook by CDC, because the troll mob is so over the top that it overwhelms the post, and it's almost not worth reading anymore. That's an example of the kind of thing that I'm talking about here when I say that scientists are speaking out about how it's harming legitimate research. So if every scientific organization is having these problems with trolls, right? If they use the internet, they're having problems with trolls. So having said that, let me see if I can get to the slide I actually finished. So, you know, this is the next point I want to just bring out, is that these false rumors about coronavirus are actually costing lives. I read an article from The Guardian that says that 40% of people in the UK believe at least one conspiracy theory. And I saw something from CNN a few weeks ago, I believe, that said it's almost 50% of Americans, it's the same thing. Those are huge numbers, people. Those are huge numbers. And a lot of this misinformation and fake news is on social media. And, you know, here we are during an infectious disease outbreak. It's costing lives, and those lives are patients and their healthcare workers. So you can make a pretty straight correlation between people deciding not to wear masks and more people getting sick and more people being in the hospital, and, you know, and the healthcare workers getting exposed. You know, it's anything from they don't have enough N95 masks to they're wearing what's called a KN95, which is a Chinese knockoff version, which doesn't protect you the way an N95 does, or a poorly fitting. So N95s are supposed to be fitted to individual people. And with the shortage of PPEs, a lot of that hasn't been properly happening. So you have people wearing an N95 mask if they're doing triage or emergency medicine for sometimes 10 hours, okay? And if it doesn't fit properly, and they're actually dealing with coronavirus patients, there's a lot of exposure there. So one of the things they're talking about with coronavirus is it's the amount and duration of exposure that matters, right? So, you know, if you talk to someone for 10 minutes and you're both not properly masked, you are less likely, in theory, to be contracting the coronavirus than if you are in a room with people that are actively infected for a long period of time, right? And then there's the outdoors versus the indoors. You know, it's much more contagious indoors than it is outdoors. And then you have people's immune response and their ability to fight off the virus. You know, so someone with a very healthy immune system, they're speculating, and we don't have any, I haven't seen any published science on this now. And, you know, I'm going to open this up a little bit for discussion in a moment, but they're speculating that people with strong immune systems who have low exposure are probably successfully fighting off the virus, as long as the exposure is low and minimal, right? And then they have this strong immune system. But if you combine someone with a weakened immune system with very high levels of exposure, we know for sure that that seems to be leading to infections. Okay, so just as a full disclosure, I got tested last week for coronavirus and I'm negative. But the prior week to that, I was with my daughter in North Carolina, who's a physician, and she has coronavirus now. And so does her colleague who's 5 months pregnant. And so does their shared, they have a personal assistant slash nanny that they share, and she has it too, right? And thank God, so the nanny's asymptomatic completely. My daughter had probably the most severe symptoms, and that's related to a prior neurologic condition and immune condition she had. And the pregnant colleague is actually doing pretty well and is probably in the recovery. But we have no idea how that's going to affect her baby, right? Because all the babies that have been born so far, when was the exposure, right? The exposure was at the earliest in February. So those babies getting born were second trimester to third trimester when the exposure happened. We're talking about a baby that was possibly exposed at the end of the first trimester. So, you know, it's the fact that we have the worst outbreak in the world right now, and the amount of people who are sick and the amount of people who are still wildly non-compliant, it is not just costing lives of those patients who get sick and potentially die. It's affecting the lives of and costing lives for healthcare workers. Okay, that's all the slides I had. I just so what I haven't gotten to so far is how do you actually spot fake news? Okay, so how do you spot fake news? The first thing I look for when I see an article being published is, are there footnotes? Are they making little numbered notes during the article or at the end? Are they giving a reference? Sometimes they do it with little notes. Sometimes they just tell you at the end it was based on this study. So I look for, are they referencing a study? That's my first question, right? Are they referencing a study? Are they referencing a medical institution, right? And I want to see those references. So it's one thing to say, there's like different levels of fakeness, okay? There's different levels of disinformation. So if you see a reference to a study, that's a good sign, okay? However, having said that, we have a problem in this across the world with what we call industry-driven studies. And so this phenomenon is especially true in the supplement world. Companies in the supplement business, they find friendly people at institutions, and they'll say, hey, would you do a study for us? And then they hire that person and they ask them to perform a study for them, right? Well, why is that bad? Well, what's wrong with that? Well, what's wrong with that is the researcher loses their independence, because now their financial compensation is tied to the positive outcome of that study, right? So if you're studying if a certain supplement works, well, you're going to design a study that statistically and structurally supports the positive outcome, right? And we can have a whole conversation on that, but that's not the place and time here. Just hear me when I say that who pays for the study is super important. So what you want is you want to see independent researchers at independent institutions performing studies, right? And I use a nutrition example, and that's fraught with problems, because people interested in studying nutrition frequently, well, dietitians do have scientific method training, but folks, naturopaths and others they're not there yet. And so they have a hard time designing a good study, and design of studies is a whole other thing. So I'm not saying that supplements don't work well. I'm not saying that supplements aren't efficacious in helping people regain their health, for example. I'm saying that finding good research on it is difficult, and that is leading industry in part. There's more diabolical reasons, but this is one of the reasons that's leading industry to sponsor research, right? But the problem is you lose your legitimacy the moment you have someone who's making a product sponsoring the research that says that product is good, okay? So that's an example of a case where you could have a reference in an article that says this was the study done, and then you have to look at the study and understand who did that study, right? But in general, a lot of what's catching people up now is not these kind of news pieces. It's completely unreferenced, hyperbolic, kind of nonsense that they'll make a statement claim, and it's usually tied to a conspiracy theory that's been promoted somewhere else. And that's kind of the connection of referencing. So the first thing you look for is this referenced? You also want to look at the language. Is it excited language? Is it emotional language? Because medical research and science research doesn't come packaged in hyperbolic or emotional news pieces. And it's also not written to be promotional, right? It doesn't look like marketing collateral, right? It doesn't mean that it has to be at a 12th grade education level. It just means that the language is less flowery and less, somebody in marketing come up with a term for me. See, I'm not even coming up with a term, but the language is more dry. Let's just put it that way. The language is more dry, and that's a good thing. And so major journalistic outlets, they generally only publish peer-reviewed science and promote it, but we're having some fake news and some misinformation actually make it through their process, and right now that's happening sometimes because the pace, especially earlier in this pandemic, the pace of information coming forward was fast and furious, and it was really hard to do good journalism and do their source checking and fact checking. Okay, so I'm seeing a lot of questions come in. I think maybe now is a good time.
Well, one question, Christine, I'd like to ask you is
Sure.
there a resource you can go to, click on, that's respected? You know, like I know some people like to use Snopes as a place to go check stuff out. Is there like a Snopes type of a well-respected place where you could say, hey, I saw this come up, you know, can it be true?
Not a universal source that I know of. I mean, I look at Snopes. I also follow Stat News. I like Stat News for science news. I think they're, okay, Tina, could you unmute Tina? We need her commentary. She's on. We're very lucky.
Unmute yourself. You've got some great points. She's just throwing in some good stuff here. Tina,
Great stuff.
just say a few things if you don't mind. You have to unmute yourself, hon. If she's there, she can unmute. Let's
see there. Okay,
yeah.
She says, mainstream media tries to get us to read the article unless it's emotional. So, you know, we do have a problem with a lot of journalistic entities now becoming more hyperbolic in the way they share news, especially their headlines are very emotional. So this is part of the problem too, is that because of the changes in journalism and their need for readership, to drive readership, they're getting more, they're tending towards more hyperbolic and sensational headlines, and sometimes their first line of an article or so, just because they want to drive readership, right? I'd say for the mainstream media, once you get into the content, they're pretty good about not spreading actual fake or fake news or misinformation.
Yeah, Tina's now unmuted. She can.
Oh, good.
She figured it
I
out.
just want to add to that is that I oftentimes will find something that's pretty inflammatory in the, and I'm talking about media, not science, but in the title. And then if you keep reading, it's like, wait, the title wasn't even what the article said. That's right. Connect, and that's a huge problem. But I will also say that I've seen a lot of people who clearly don't have science backgrounds quoting journal articles and basically coming to a conclusion that a scientist would have not come to. Like, they're just not, it's like they don't understand the context for understanding the background and really understanding, like, why people would, like a journalist would a scientist would often look at an article and go, oh, that's interesting news. That's a first finding. More research needs to be done, right? That's how we look at new information. It has to be done with abundance of caution, and you always have tons of more information that in your mind. So you're not just going to go jumping on that bandwagon so quickly. You've got to, like, all these details have to get hashed out and understood, right? And they have to be looked at in a huge variety of ways. Oftentimes, like, the first study will be a very small sample size. And so that could have just been in a population where it just happened to show a relationship. Whereas if you take it to a different population, that relationship may completely disappear, right? So there's just so many different factors and things that need to be examined before research is really going to be seen, or researchers are going to be confident that something is true. So what really is true is that science is a slow process that converges towards the truth. And it takes multiple repetitions from a variety of samples and sample sizes and approaches to do it. People have to, a huge variety of people have to look at it to make sure that the original author wasn't biased in some way, because it's so easy. We're all subject to biases, and there's so many possible ways we can be biased.
Right.
And scientists are trained in that, and even scientists are subject to bias.
And to further your point, I mean, and in terms of sensationalizing things and bias, you know, it's not limited to the promoters of misinformation per se. So, for example, we had a couple of writers that were contributing to Forbes News for some years, and they were allegedly, it was two guys, doctors, and they really had an axe to grind with complementary medicine, okay? And these guys were basically just rejecting out of hand anything coming out of the complementary medicine world and calling it quackery, all right? And they've made a website, it's called Quack Watch.
Mm-hmm.
And they were posting they were writing and getting published on Forbes the most outrageous articles, and it was basically like, you know, scientific trolling almost, you know.
Yeah.
I haven't seen them getting published in a while. Tina, have you seen them getting published?
Not in the mainstream, no, but I know exactly what you're talking about. There's a guy, I'm blank on his name right now, but he was clearly, I mean, we know that he was funded by a pharmaceutical company.
Yes.
And he trolled me. He was like from Yale. I forget his name right now, but
Right.
I wrote an article on a review of brainwave entrainment, which is a very simple and a cheap and effective way of entraining our brains to different frequencies. And it's an article that really has made a big difference in the field. And
Sure.
Oh my goodness, what he wrote was just so, it was very derogatory and inflammatory. And when I tried to write a counter, I tried to counter his argument, he only published the parts of my arguments that he could counter.
Of course,
he did not include a lot of the statements. Like one of the statements I made was, you know, this method is so cheap, so accessible, and, you know, you don't think it works. So why not just give it a try and see, you know, just see if it works for you. Like,
right. Because
you know,
the risk of harm is negligible, right?
Exactly. Right. And I wrote that, but he didn't publish it, you know, like just,
not.
but there were so many different things, and it was much more like bias and attempt to put you down than really a scientific, discussion, you know. And you can tell when somebody's in attack mode, they're not interested in finding the truth. They're interested in putting you down and winning. And I think knowing the distinction between people whose aim is to put you down and to win versus those who are seeking the truth can really clear up who to engage with and who is legitimate. You know, I think people who are passionate about finding the truth are always asking questions and wanting to know, oh, so what do you think about this and so forth. But people who are like belittling each other and calling each other sheep and all that, I just like, they're not worth engaging with.
Well, and in terms of, and I brought those guys up as an example because those bad actors, and, you know, everywhere in the world you're going to have bad actors, right? So when I make statements about the scientific method and the science community and physicians and evidence-based medicine, those are all factual, you know, descriptions of how that culture evolved and how those disciplines are trained. But that doesn't mean you're not going to have bad actors. And so when you have people like this, these bad actors, they are damaging the profession, especially in this day and age of social media, immensely, because they're creating fodder for all the conspiracy theorists out there, right? And all the people who are willing to believe that, you know, well, you know, we don't know what to believe, and, you know, everything's fake news, and their behavior is contributing to that problem on the other side. One of my favorite evolutionary things. So, as I said earlier, I really love Stat News. It was founded by science and medical journalists, And I think that's where I go when I want to see what's really new in the science world, because they're not sensationalizing it like CNN, and they're not distorting it like Fox, they're not, and all that kind of stuff that we all know about the mainstream media, right? And what I love is, like, Fox likes to call MSM, everyone else MSM, but they're just as mainstream media as the other side, right? That's the reality we're at. But so extending off of Stat News, they created a new website called Retraction Watch. And it's retractionwatch.org. And what the value of that place is, it's a database that they're building of all the retractions from science journals all over the world. And so if you're a researcher and you have a tendency to get your research retracted, it's showing up there as a trend, right? Mm-hmm. And individual cases you can find, and certainly you can see people who have a pattern because they're starting to highlight those people, right? So the bad actors, there's a place now to go look to figure out who's a bad actor. I mean, just because someone was involved in a paper that had one retraction, that doesn't make them a bad actor, right? But we're seeing a lot of, a handful of people. There's a guy at Duke University who lost his position in the School of Medicine and another department because he had something like 14 retractions piled up. And then it turned out there was a misconduct allegation at Duke against him that had been sort of smothered because he was a tenured professor, et cetera, right? So there's a place to go, at least in terms of checking on the science side of it, and that's Retraction Watch. But to answer Jill's question, I'm not aware of any website that's a clearinghouse, if you want, for all, like Snopes. I mean, there's Snopes, and I think there might be a handful of others, but I'm not aware of one specifically for medicine and science.
Yeah.
So Tina and Christine, so to add on to that question, because of the social media, and because they're doing a lot of videos, and I'm watching these people post things from YouTube, and they just can blow up, and then pretty soon, social media, and I don't believe social media should take things down, because as earlier we kind of talked about the free speech, but to be able to say, here's where, this has been proven wrong, this is where you can go. So I think there's an element of personal responsibility that is so important, that we don't share some of this stuff unless it's been vetted, unless it's gone through the scientific method, to hold standards to that in any conversation you may have. But if you two could kind of address, because we are seeing a huge blow up in people doing video. You're going to see doctors in white coats going, this is baloney, this isn't where, and the rest of the world going, oh, and then trying to make a victims, and then make the Dudley do bad out of a person who's had respect before, tearing down their respectability. So can you both kind of share or speak a little to that?
Well, we had this week an example of the President of the United States retweeting a video of this woman who allegedly has a degree in medicine, standing in a white coat with other people in white coats who were, I guess they were hoping that we would assume that they're doctors. Standing there saying that the coronavirus is a myth and that masks are not necessary, and basically directly attacking and targeting Anthony Fauci. And the president retweeted this, right? Well, this woman apparently is from Africa, and she may have a medical degree, but she's apparently somehow a spiritual leader at some kind of cult church in Houston, is my impression. And that's to your point, Jill. So I think with anything you see, you watch whatever it is, and you look at it, and you ask the question, is that real? Right? Okay, is that possibly true? So then you investigate it, right? So first of all, a video, I would never republish a video unless it was from someone I know, and it's a press release. So for example, the last time I retweeted a video of someone in the news was when the University of Washington announced that they now had a really high quality antibody test, and they'd given a press release, and I put that out on Facebook and Twitter because it was legit, and they had the content to back up what they were saying, and it was coming from a clearly legitimate source. It was people with names wearing University of Washington garb, sitting in front of a building at University of Washington, you know, telling us what they had accomplished, right? But so you always want to ask yourself, what is that content? And generally for videos, I'd almost always err on the side of no. You know, I mean, recently I had some experience learning about this guy named Z-Dog, and he has been doing some pretty good videos kind of trying to push away myth around coronavirus. And then I find out that this guy has been accused of trolling at Emory University, of trolling other doctors who were promoting the addressing of the issues around physician mental health. And apparently he was targeting people who were trying to talk about this issue, and he went pretty far. And I was kind of like, oh my gosh, not this guy too, right? And there's some speculation that he has some connection to either the Proud Boys or militias, apparently is what the suspicion is. I don't know that. I would never put that in an article. It's not been verified for me personally, but it did cause me, just learning about his trolling behavior of other physicians certainly gave me pause for concern. So, you know, I almost repeated his one of his videos because it seemed pretty good content, and now I'm super glad I didn't do that. But anyway,
yeah, I can do it. So
right.
Tina, because we're getting down here on our time, and I promised Christine I would hold her to it because she's got a lot to get going. So Tina, any thoughts on this before Christine finishes us off on this conversation?
You know, one of my passions is understanding biases and understanding how we're subconsciously influenced, right? So, you know, I read books like I'm reading right now, Daniel Kahneman's Think Fast, Think Slow. I'm reading, you know, I've read Blink and all of, you know, a lot of Malcolm Gladwell's books. I listen to Hidden Brain. I mean, there's just so many different studies of biases from psychology and sociology and behavioral economics. And then there's like understanding statistics and how we can be biased by that, right? So I've got, you know, my training in epidemiology and then in neuroscience and so forth. And so I will tell you that understanding biases and knowing what's fake and what's true is really hard. And I really think, I think that UW is starting to do having some really interesting discussions about fake news. I just posted a link about the department.
Yeah, I'm going to put that in my slides.
Okay, great. Yeah, they've got a new class called Introduction to BS, and it's actually online.
Yes.
For free. And I think it's super important. I hope that we actually start to have majors in BS, like understanding fake news from non-fake news, because the more I learn, the more information I know there is. And even though I learn about so many biases, I can't remember them all. And I'm subject to them as well. Like, I think the more I learn, the more I realize, oh, I'm still subject to biases, even though I know so much, right? And so I really do think we need to have universities start having majors in fake news, like people who are or ability to discern truth from fiction, and then they can go out and put them on a mission, put those kids on a mission to discern what's fake and what isn't, and to like name all the biases that we're subject to and really educate the rest of us. That's what I'd like to see done, because I think we need a concerted kind of global effort on this, because it's so dangerous, not only during a pandemic, but you know, I've read about genocide. It's dangerous, you know, when governments become extreme and when fake news gets propagated, and when when there's certain alliances that want to do us harm, they'll start to spread fake news. And fake news has been, you know, when I read Hamilton, I was like, oh, it even happened during Hamilton era. Like, it's been happening forever. And it's time to put it to a stop and use our education. Now we have so much more information with regards to biases from science and from all these social sciences as well. It's time to put it to use and to really, you know, use it to make a difference.
Yes.
Educate people. And the more we keep telling people, look, you're subject to this bias. Like, there's a bias, for example, that I want everyone to know about from Daniel Kahneman. It's called, what you see is all there is. And basically, it's the idea that if we are not educated and we only see like, you know, a couple different variables involved, like, you know, somebody who doesn't know about pandemics just says, oh yeah, it's, you know, it's masks, you know, they see a very limited number of parameters or possibilities. They're very easily persuaded by the ones that they know, right? But a science, you know, somebody who's actually trained in it can add all these different contingencies, like, you know, well, have you thought about this? And have you thought about this? And you've thought, you know, they think about it in a much bigger picture, right? And so scientists, the people who are most trained, are the least confident. It's why scientists are so cautious, right?
Right, exactly.
Cautious because they know that if they go into a meeting and they try to defend something, or if they present a paper, they're going to get hounded if they don't, you know, speak the absolute truth, and they will get hounded regardless.
Right, it's back to that
Always
scientific
regarded us.
method thing, right? And it's back to that whole concept of peer review and the fact that you're supposed to examine critically
Yeah.
what your peers are publishing and what they're saying and doing.
And the system is set up for that, right? And the system on social media is not set up for that. Neither is journalism, unfortunately. Journalism used to be have a lot more integrity, but it's lost over the last 30 years. So with the rise of the capitalism in media. So yeah, we need to like gain awareness about how our media is influenced and how we're biased as well. And there's a lot of information out there. It just needs to be better spread and
absolutely. Well, this was so meaty, and I'm going to stop the recording, and I want to thank everybody, because the people on this call, we will, once I start the recording, we can ask you a few questions. So if Tina and Christine don't mind staying just about 5 minutes longer. As I end this, I want to thank you both. I want to thank everybody showing up. Christine, thank you so much. That was so meaty and lots of good stuff. Keep safe, keep healthy. Keep checking out us on Illuminating Women. Thanks, everybody. Have a great rest of your day. Bye-bye.
Thanks, Jill.